the best chance at recovery. ECMC is the only adult level 1 trauma center for Western New York. We plan
mobilize what is essentially usually a full hospital and make space for 20 plus victims of a car wreck. You know, the initial report was that we had 50 plus patients coming, which we would have been able to accommodate. So everyone from the housekeepers that keep the rooms clean.
I know you train for this all the time. Have you ever had a mass casualty incident with this many patients at once?
It's been a long time.
Yeah, I can.
Can you recall any others that
one
here?
without maybe not this many patients.
Okay.
You know, but on a microscopic scale, we do this every day, right? So any patient that comes in here from a car wreck or a gunshot or a fall, they're evaluated in the same way. So you're just multiplying that, and we use force multipliers by bringing all the assets we have in the hospital.
Mm-hmm.
Any patient that comes in here from a car wreck or a gunshot or a fall, they're evaluated in the same way. So you're just multiplying that, and we use force multipliers by bringing all the assets we have in the hospital.
Mm-hmm.
So we bring all the residents down on surgery that are in the hospital that may be on other services. All the orthopedic physicians and their residents came down. So you just magnify and multiply what you have in the hospital and do the things that we do every day, just on a larger scale.
But, the question was, have you ever had an incident with this many at once?
I've been here 25 years, and sorry. I've been here 25 years. This is, and as Peter had mentioned, I'm also a member of the Department of Emergency Medicine. This is probably the most trauma patients we've had from one incident in my career here in Buffalo.
Over 25 years.
Over 25 years.
Can you talk about the
numbers real quick? 24 patients came into ECMC. 2 of them went to the operating room. The 2 others to trauma ICU. That's right?
I believe that's right.
And the remainder are being evaluated.
Yeah,
so.
we still have 20 that are currently in our department receiving active care.
Do you know the breakdown? Because
Reiterate, I know this question was asked, but we were able, with the new emergency department, we went from a very small department in the old hospital, but now we have a 53-bed emergency department. We have 4 large trauma bays. We were actually able to clear every room with the help of our medicine colleagues so that if we did receive all 50-plus patients, we would have been ready. We're very fortunate with the new setup of even the ambulance area. We're doing triage outside and making sure patients were assigned to the appropriate areas.
We actually designed this new emergency department for mass casualty incidences. That was one of the primary things we were thinking about when it was designed, so that we could have good ambulance flow and patient drop-off right next to the area where they'd be evaluated for traumas. And so I think today was proof of that concept working.
Yeah, and of all the hospitals in the market, anyway, ECMC is the designated mass casualty center for Western New York. You know, and again, as Dr. Cloud said earlier, we are, as I think you all know, the only level 1 adult trauma center for Western New York. Oshai Children's is for pediatric cases, which would be 16 years and younger, but ECMC is for adults.